Every business is a little bit different. We have to be smart with labor.
We need to make sure that we're working with efficiency.
How do you win with labor in the United States today? Welcome to the Offsite Team Podcast. I'm here with my good friend April, and we're going to talk today about winning with labor in terms of labor being so doggone hard these days. It's just stacked up against small business owners. How are you today, April?
I'm feeling good. How are you?
I'm doing amazing. Hey, on a
Good.
side note, one of my very best friends went to the Philippines last week, and I'm dying because all of his Facebook and Instagram pictures, and he's just like jumping off waterfalls, having fun with his daughter. And I'm like, oh, I want to come see you guys again because your country just looks amazing. So
You have to.
I might have to just come next week to just not to work, but just to go play because your country looks so amazing. Now, what's not amazing is the state of labor in the United States today. You probably missed this, but there was, in the state of California, I heard on the news that they're making a labor rule that you cannot force your employees to work after hours or if they're not scheduled. And I'm thinking to myself, I mean, that sounds good. You can't force someone to work. But here's the thing. Like for us, we have multiple hospice contracts. Other companies, you have respiratory care patients that you need to service 24/7, 365. What do you do? And how do you handle labor when in a lot of the more liberal states, I'm in Washington State, but you have California and you have other states that it is stacked up against the business. And how do you handle that? And it makes it really, really difficult. Now, on other countries, there's like the Philippines, where things are not stacked in your favor. They're stacked in corporate's favor in the Philippines, which is why so many amazing, amazing employees in the Philippines want to work in the United States because we do treat our employees really, really well. There's a nice fine line in the middle, though, because we all need to make money, but then we need to compensate people. So in other words, how do you win with labor in the United States today? What does that look like? Now, it's really, we came up with another 3-point, it's really simple. There's 3 simple points to winning with labor. So first, if you don't know this, step 1 is just what needs to be done at work. I know that sounds simple. Well, of course, Eric, people need to work at work. No, what needs to be done per job at work to win? So what this means is for your billers, how many claims do they need to bill per day? And what does a claim billing look like? For prior authorizations, what does that look like? For your CSRs, what does that look like? And we're going to get into this next week on our podcast. So next week's podcast is going to be on the digital journey for each patient. But one of the things is before you can win at labor, you don't just hire people to work. Because if you hire people to work without giving them a clear job description, clear KPI, clear KRAs, if you don't know what those are, go back and listen to the previous episodes because we went in detail what that looks like. But you need to know exactly what each job is going to do. There's a huge durable medical equipment consultant in the industry, and all this consultant does is literally they're just going to come into your business and ask what needs to be done. And they're going to charge you a lot of money for asking some really simple questions. So step 1, what needs to be done? So let's just kind of run a little game, and let's say a biller. So someone who confirms what needs to be done for someone who bills claims.
We need to make sure that we're working smarter and we're working with efficiency.
Okay.
So
what's that look like?
So if I'm a biller who's confirming an order, I want to make sure that the insurance has been checked. We have all the documents in order for the claims to be submitted and be billed on time. We don't want it going back because we confirmed we haven't checked this and we did not put the information that we have to.
Yeah, they need to put the right modifier on. They need to make sure it
modifier
gets to the insurance, the claim gets paid, it comes back. And what we use to check to make sure our biller is doing a great job is we track error rates. How many claims come back and need to be billed a second time? How many claims come back and need to be billed a third time? And it's basically on a per claim basis. So what needs to be done in that position? For our CSRs here in the United States, this is not a position that gets outsourced because they're our front end. You walk into any of our 5 stores and how many patients do they help a day? How many sales do they have per day? And what does that look like? And we have different metrics for that. Any of our current customers, we share all of this information with you because it's one of those things. I love to share our info because we've spent well over 20 years coming up with this data. I would love to help the small independent DME win by giving you our numbers. And sometimes what actually happens is you'll give me a little bit of your numbers too. And then what we end up doing is like, okay, we're about 80% right. You're kind of over here. You're 80% right. And then when we put our heads together, we end up at about 95% right. And so, but we really need to know per position, marketing, fax wranglers, communications team, you name it, what needs to be done for each individual job. And everyone needs to know it. Now, if you wonder, now, most people who listen to this podcast, you're either the CEO or you're the owner of the company, and you know all that. Where the rubber meets the road is I have found out most employees don't know it all. So even though they do, the other ones don't. And this is where certain checklists come into play. And so it's one of those things. So step one, what needs to be done at work per position? You have to have that in order to win at labor. So step number two, what are the proper expectations per team member? Every team member has different expectations. You might say, Erik, everyone on our team has the same expectations. They shouldn't. I have 4 kids. All 4 of my kids, I have different expectations for my kids. Why? Because they're different ages. I'm going to expect more out of my college sophomore than I will for my 6th grader. Why? There's different maturity level. And so you can't just say, I expect the same thing for all of my different team members. I have certain people, they are so gifted in repairing wheelchairs. I'm not going to ask them for certain billing expectations. So it really changes per team member. So for example, what might you expect for someone who's in CPAP? CPAP or oxygen, and that's what they're doing and setting up. What might be some expectations for that kind of team member, April?
Well, expectation would be to be able to complete documentation, and for documentation, to complete documentations per week. We do have this KPI that we've set. So there's this goal that they have to complete within a week, but we would be happier if it's more than the required KPI.
Oh, absolutely. Absolutely. And so it's one of those, even on CPAP setups, the number of CPAP setups where the patients are using their machines, that is one aspect of really, I forget what we just call them team members where we're at. Some people call them PAP setter-uppers. But how many CPAP setups do you do a week? What is the success rate of those CPAP setups? I had a team member a number of years ago. She's like, Erik, I'm doing the best I can. I'm like, 40% of your patients are not compliant. I don't think that's our patient's fault. That's totally our fault. She said, oh, this is how it is. And I'm like, well, so we brought someone else in and he was running at close to 90%. So here we are. The same patients, one was running at 60, one was running at 90%. Now those 60% patients, those are expensive because then you're not going to get month 4 of the CPAP covered if you are not compliant. And that falls onto me as owner and CEO because I was doing a lousy job of training that one team member. Now, actually, what we did in this case is we did end up figuring out what the problem was and we corrected it. And this person did not lose their job. It was on us because we were training not in the most effective way. And we figured it was something as simple as following up with a patient who had just been set up sooner rather than later. And the cool thing is we primarily use ResMed CPAP machines. We use a couple other brands as well too, but they'll tell you if your patient's not compliant. So what we do on that is, let's say the patient's not compliant after 2 days, one of our offsite team members, they're reading those reports and saying, hey, Mr. Smith or Mrs. Smith, hey, I noticed you didn't use it last night. Oh, it's kind of fitting funny. It might be something as simple as a CPAP refit. It might be something as simple also as, oh, they know they're watching now. I better get my act together. And that's all that it takes was that one phone call and compliance went off the chart. So this is one of those things. In PAP, that's what it looks like. In billing, what are proper expectations for billing?
For billing, we want to make sure that we put in the correct modifiers when we send a claim, because sometimes we can get denied on those just because we're missing out modifiers.
Are modifiers the same for all insurances?
No.
And that's what my heart is. Like, I know how to bill Medicare claims. Well, this Med Advantage claim is different. This Medicaid plan is different. Well, what about the left side? Different. What about the right side? Different. What about month 1? Different. What again? It's just like, are you kidding me? I swear they made modifiers to make it easy. But I mean, if you were off 1 comma, actually don't use commas. Commas are not usually used in modifiers. I'm not a biller, but I know that. And so a funny story, a couple of years ago, this is way before we hired you. And I was like, our billing team was working so hard. This is before we had the offsite team. And I'm like, just press the button. I don't care. Just press the button. And my billers just about had a conniption because if you just press the button without the wrong modifiers, what happens?
It will get denied.
It just comes right back to you.
Yes.
They're like, that's not going to help. It's not there. There is no partial credit usually in billing. There are a few, actually, there are a few insurances out there. It's the manual, super small insurances. They might actually pay. It's the paper claims. If I understand what they're thinking, not many of those. And actually, this is like 5-10 years ago. I'm sure those are not even around much anymore. But back in the old days, there actually were a few that they would just pay off the invoice, and you could get by without the right modifier. So there's PAP, there's billing, rehab team members. What are some expectations for rehab team members in order to win at rehab?
We want to make sure that we do the fitting correctly, because we need to make sure that we're giving the correct chair for the patient. Because if not, then another documentation will be requested, and another PT evaluation.
So there's the billing side of rehab. So we have almost all of our offsite team members are doing all of our rehab billing for it. But then we have the US based side of things. And we have, I want to say, 5 different team members here in the United States that they do wheelchair fittings for us. We treat all of them differently. Some focus on high-end custom, some are standard K1 through K4 chairs. It really varies. And so you can't have the same expectations for every single team member. But in order to win at labor, you need to know what that is. And we do have that. I have a retraining taking place where someone was put a patient into a really, really nice wheelchair. But when we got into it, the patient wasn't using the wheelchair. And in this case, we need to do some re-education of a team member, because he was putting the team member or putting the patient into a higher end wheelchair than what this person truly needed. Now, the fascinating thing is we actually put the patient into the wheelchair that the provider and physical therapist requested. That's exactly what we did. So everything that we did, but it's one of those things, even though we did that, the patient wasn't using the chair. And actually, the patient would have been benefited from a more affordable chair, not as expensive, but it's so there's a fine line. You can't treat everyone and every person the exact same. Now, what's hard also in terms of winning at labor is there's also almost all of us, we deal in retail. Retail is not the same. So you can say, okay, on average, I can help 4 customers an hour or 6 customers an hour or 2 customers an hour. Well, that's great if someone's going to come in at 9, 9:30, 10, 10:30. Well, what happens is we'll go an hour and a half with maybe 1 customer, and then all of a sudden we'll have 5 customers walk into our store. Well, how do you account for the ebb and flow of the waves of customer traffic that come in? That has to be accounted for too. And it's really difficult. So some people will say, I only want to do PAP fittings, or I only want to do this. Everyone has to do at least 2 things well. Even better, 3, 4, 5, because then you can kind of ebb and flow as traffic goes back and forth for everything. For our communications team, what's a proper expectation of a communications team member of ours?
First and foremost, we have to answer the phone calls within the
60 seconds.
60 seconds.
We will pick up that phone call.
Correct. So that's the number one thing. And then number 2 is we want to make sure that we are providing them the information that we have. We don't lie to the customer, or yes is our yes, or no is our no.
And you were politically correct. And we need to sell. You could say, I answered all these phone calls. No, we need to sell. We have a sales per hour, because we are paying labor. It's one of those things. Labor is very expensive. So there's a certain amount of expectation. You need to make money. People listening to this podcast need to make money, because if you don't make money, I'm sorry, we're a greedy capitalist. Not a greedy capitalist. Just capitalism works. We need to make money so we can pay our. If we don't make money, we go out of business. And if we go out of business, not only do we not get paid, we can't pay our employees. And if we're out of business, we can't take care of our customers. So there's this cascading effect. And so this is why you have to understand what are the proper expectations for every single team member. Now, step number 3, I'm going to go non-politically correct, but if you're listening to this podcast, you know exactly where we're going. What can be outsourced? So it's one of those things I'd love to say, if the government's going to triple our reimbursement rate, everything can be housed in the United States. That's not the case. What did Medicare just do? They just cut our reimbursements 20 to 35%. You cannot cut 20 to 35% and hire more US-based team members. Not possible. So April, what can be outsourced?
They can hire, work with us with the offsite team.
Yeah, we're biased. We want to work with you, but yeah.
Yes,
But like, what
correct.
can be? Give me an example of something that someone might not be outsourcing today,
Mm-hmm.
and you might want to start somewhere. What's an example? What can be outsourced?
Yeah, so we have one of our team members is trained for fax wranglers.
Mm-hmm.
Now, if their on-site is working in their fax and also helping the patient at the same time, when they hire the offsite team member, we can help you with the fax flow.
Mm-hmm.
So our fax wranglers are great with working on those documents, being able to identify the documents, uploading it in the data. And also we can track the numbers on that one, which is they're really good at. And we have this cheat sheet that if they call us at the offsite team member, we will be able to help them with that one. We can share the cheat sheet that we created, that automated, that makes the work efficient.
And it's one of those things. Maybe we should use the term cheat, but I need to ask ChatGPT, what's a better name for a cheat sheet? But that's what it is. How
Correct.
can things come in faster? In the old days, we'd have to do all the stuff ourselves. You're handing us, you'll say, Eric, here are the three orders that came in. We've checked all their insurances. Please go call them and let them know this is what they qualify for, and this is what it's going to take. So I love it. All I have to do is call Mrs. Rodriguez and say, hey, we have your walker. It's been covered. Your copay is going to be this. You may pick it up today. It's already been authorized. Bam, bam, bam. How easy is that?
Correct.
In the old days, they would walk into the store. We would have to call the insurance. We'd make them wait. We'd have to wait. We'd have small talk. Sometimes it would go fast. Sometimes it would go slow. What you allow us to do is really handle many more customers than we typically would. And it's nice too, because, even though we close at 6 p.m. at night, we have several offsite team members. You're working to like our time, 10, 11 p.m. at night. You guys like it because you're working your days. And so you can't call our insurance companies that late, but you can do a lot of the back end paperwork, right? Tree work at our night, your day, which is really, really nice. And so other things that can be outsourced, data entry. No one should be, unless it's like your kid you're trying to teach, trained adults in the United States should not be doing basic data entry, putting things into the computer. What else can be outsourced? Certain automations. And this is not even with offsite team. Use AI, use macros, use different things that you have built into your system to automate the process. And this is one of the great things that your husband did. Your husband's working as one of our fax wranglers. He's like, I don't need to do this. And so he built macros to do the work for him. He'd get it started, and then the computer program would take the rest of it. And so now it's just going really, really fast. We're like, how did he triple the progress of what he was able to do? He works smarter, not harder. Other areas, billing, I see no reason for you as billers anymore, with the exception of the higher end managers. So even here at our businesses, we have local United States billers. We still have billers here in the United States, but there are higher end ones overseeing all the locations. But then the ones actually doing the claims, those are being done by our offsite team in the Philippines. Any other areas that I missed that can't be outsourced, or what can be outsourced?
Marketing.
Oh yeah, marketing too. Absolutely. Yeah, we have people in the Philippines doing marketing for us, and it's good that doing market research for us. What are our competitors doing? It's pretty awesome. So it's really anything can be outsourced. Now, to what degree? What is your standard? What does that look like? It really varies, and every business is a little bit different. But we have to be smart with labor. Because if they're going to say, hey, you can't call certain team members after hours without really high-end compensation. We've always compensated our after hours workers, but it's like, how much do you have to pay them for being on call, and what does that look like? Just work smarter, not harder. So next week, this is going to be kind of weird. We're going to talk denials again, but how can you use denials to your advantage? So literally every time a denial comes in, last week we were talking about community health plan, what happens with their bizarre denials that they do. How can we use denials to our advantage? Say, hey, I am thankful for this denial. What can we do? It can really change how we look at things, and we can use them to our advantage. So next week is how to use denials to your advantage. And in the meantime, if you need help winning with labor, we are here to help you with the Offsite Team Member. And go to offsiteteammember.com. Give us a call. We'd love to talk to you. I think currently we have 2 or 3 team members ready for hire. So you could literally call us today, and tomorrow we could give you a offsite team member to help you with your business. We'd like a little more time typically, but it could be as soon as tomorrow if we had to. If you just say, I'm stuck, I need help tomorrow. Okay, we will help you. Give us a call. But until then, hey, have a very, very good week.